Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
If you're like me, you're sneezing, sniffling, and looking for relief. Spring allergy season has sprung with a vengeance thanks to that rainy, warm winter. So here with survival tips are award-winning pediatrician and medical editor of KidsDoctor.com, Dr. Sue Hubbard, and pediatric allergist, Dr. Drew Bird of Children's Health. Doctors, great to see you.
Good morning.
Hey. All right, so let's start with you, Dr. Sue. How many children are suffering from allergies this time of year?
You know, the statistics are about 10 to 15% of children. Typically, we see this before the age of 6, but over the age of 2 have seasonal allergies.
And what would you say is the most common allergy?
The most common allergy is really for the pollens in the air. And right now, the most common allergy is from the trees. So all the yellow that we see from the oak, the elm, the mulberry.
So Dr. Bird, it's so hard to tell, I think, the difference between what's a cold, which is also going around right now, and the allergies. So kind of break it down for us. What are the most common symptoms if it's an allergy?
Yeah, so the most common symptoms you see will be itchy, watery eyes, sneezing, congestion, runny nose. You will see that with allergies, they tend to last throughout a season rather than an infection, which tends to resolve itself within a few days.
All right. What about relief, though? How do we find it? What's the best way to find it?
We're lucky there's many over-the-counter medicines now that you can use. So I brought some. So there's over-the-counter antihistamines, there's over-the-counter steroid nasal sprays. It's nice to use a saline rinse in the nose, especially for younger kids. Would you agree, Dr. Bird?
Absolutely. I think the saline rinse is perfect. A lot of parents like non-medicine type of solutions, and a saline rinse will rinse those pollens out and keep the nose clean and easy to use.
Let's say a parent takes their child to a pediatrician. When would you know it's time to refer them to a specialist like Dr. Bird?
I think parents who have children who seem to have allergy symptoms that aren't responding to typical medications that are used continuously, because that's the biggest thing. You can't use them intermittently. Then I might refer them to Dr. Bird. Also, if they have, asthma with it, and that's exacerbating their symptoms.
What about the season? How long is it going to last?
Yeah, well, it depends on what you're allergic to, but if you're allergic to seasonal allergens like tree pollens, those will last throughout the spring. Grasses tend to start late spring through the summer, and then weed allergens pick up in late summer and through the fall. And then we have mountain cedar here in Texas, which lasts through the winter. So if you're a seasonal allergen person, it can be year-round. And there are also other things in the environment like dust mites, cats, and dogs that could be year-round allergens.
We're a cedar fever family, and man, the symptoms aren't necessarily what you think they are. Some of the symptoms can be tricky. We experience nausea, abdominal issues too with the cedar. Do you see that sometimes?
More commonly, we see the itchy, watery eyes, congestion, sneezing, runny nose, but people certainly feel miserable, so you can see a whole host of things.
Okay, well, in addition to those type of allergies, of course, myself included, a lot of parents have concerns about food allergies. And I understand there are some new, pretty exciting advancements in diagnosing those.
Absolutely. Well, yeah, and in preventing food allergy, actually. In the past 2 years, more has come out in how to prevent food allergy. As you know, we've seen a rising incidence of food allergy, and some interesting studies have come out showing that introduction of foods like peanuts or eggs early in the first year of life might actually help to prevent the onset of those allergies, particularly for kids who are at higher risk of developing the allergy.
So we should be postponing those foods for
or
just the opposite.
Just the opposite. So
how early should we be introducing them then?
The first study showed between 4 and 6 months seemed to be a lot better, and certainly in the first year of life. But a newer study shows that as early as 3 months might be beneficial.
Really? That's so interesting. It kind of goes against, at least when I was a young mom, what I was taught.
It's new data, and certainly you wouldn't want to introduce just like a peanut to a small baby. But if you would solubilize peanut butter and make it into a soupy consistency, or take an egg and puree that and feed that to a small infant regularly, so at least twice a week, that might be beneficial.
Some really helpful information, and I love it. We have rhyming Dr. Sue and Dr. Drew today. Thanks, guys. We appreciate it. All right, you can find out a lot more on spring and food allergies at childrens.com or kidsdoctor.com. You can also follow Children's Health and the Kids Doctor on Twitter and Facebook.
More than 100 years, 30 locations, 50 specialties, countless ways to care, one new name. We're Children's Health, and we're by your side.